Good afternoon, everyone. Thank you for joining us today for our second September community chat. I'm Bex Hayhoe, the Director of United to End Homelessness with Orange County United Way. Our last community chat for this month, we talked about how the topics of gender and domestic violence intersect with homelessness. And if you missed it, you can find that video on our Facebook and on our YouTube pages. For today's session, we're going to be talking about family homelessness in Orange County. This is a really important topic to discuss. The last point in time count we had found 466 families experiencing homelessness in our community. To help us talk about this really critical issue, we're joined by Nikki Buckstead, the Executive Director of the Family Solutions Collaborative, and Timothy Huynh, the Chief Program Officer for Mercy House. I'm very excited to have both of you with us today. So we'll spend a little bit of time with each of you. Can you take it in turns to explain the unique role that your organization plays specifically in addressing family homelessness here in Orange County, and why those services that you offer are so crucial? And Nikki, we'll start with you.
Great, thanks so much, Bex. And thanks to the United Way of Orange County for hosting these community chat series on homelessness. They're very important, especially now during COVID. And of course, I'm really excited to be here today with one of our community partners, Timothy from Mercy House. So thanks so much. The Family Solutions Collaborative is made up of 21 of the leading family service providers in Orange County. We came together to form the collaborative to create a coordinated and timely response to help prevent families from entering into homelessness and to house them efficiently and quickly. We also have 8 access points throughout the county, which provide family navigation services to the families. So the Family Services Collaborative, also the FSC, along with our 21 member agencies, serve literally homeless families. We work to connect them to permanent housing opportunities, which can include things like rapid rehousing, transitional housing, vouchers, and permanent supportive housing as well. These housing opportunities go through the family coordinated entry system, which the FSC operates, and it's to ensure that families are able to access permanent housing options. This allows us to connect families in a coordinated, streamlined manner to housing opportunities that provide the level of support that that family needs. And of course, we also connect families to other supportive services that they might need as well. We also operate the Orange County Bed Reservation System, which is again another streamlined way to connect families in need of shelter to available shelters across our network of family shelter providers. This really ensures fair and equal access for families based off of priority rather than based off of who can get to that shelter or call that shelter first. So prior to this, families would have to call or drive to the family shelter to see if there was an opening, which of course was a huge barrier to accessing services. And then we also provide temporary motel placements where families and their children can get off the streets while they're waiting for shelter. We work to prevent children and their families from becoming homeless as well. Oftentimes we have families who come to us because they were unable to pay their rent and they're receiving an eviction notice. I know that that's a little different right now with COVID and the eviction moratorium, but we work to keep families at risk of homelessness housed by providing utility and rental assistance in our prevention programs. We know that if we can prevent children and their families from experiencing homelessness, there is so much less disruption in their lives.
That's wonderful. Thank you so much, Nikki, for that comprehensive overview of the role of the FSC. And Timothy, we'll turn to you. Tell us, Mercy House has got a huge footprint here in Orange County and in other counties and other states as well. But would love to hear about Mercy House's role in addressing family homelessness from you.
Well, thank you, Bex. So Mercy House is a homeless services provider that we started here in Orange County, but as you mentioned, we do have a significant footprint kind of across Southern California and even reaching into Arizona. We're probably primarily known for our shelter programs. We operate a handful of shelters across Orange County and some in LA and Ventura County. But our family shelters here in Orange County include the Link in Santa Ana and the Family Care Center in Orange. We also operate a whole breadth of programs that are designed to address the needs of homeless folks wherever they are in their struggle and at whatever level of need that they present, including, and as Nikki mentioned, some prevention programs, which are ideally, if we can stop someone from becoming homeless ever, especially for a family with kids. The trauma of homelessness is something that we don't want any children ever to experience. And if we can stop them from becoming homeless before they enter and have to go through our entire system, I think that's one great part of the system that we are part of. But we also do rapid rehousing, so that's a style of programming that's designed to take as quickly as possible with as light a touch as possible someone who's homeless or a family that's homeless, and connect them to services and resources to become housed and stabilized in that housing. We have emergency shelters, as I mentioned, as well as low-income housing and even some permanent supportive housing. So that's housing that is surrounded by ongoing services for folks who have maybe some really higher needs than others. I'd like to mention the Family Care Center here. One thing I noticed looking over our statistics for the last year was we were able to increase our successful housing placements out of the Family Care Center last year by 12%. And we do attribute that very largely to the Family Solutions Collaborative being able to fold in and connect our clients with other resources that they need.
That's wonderful. Can you share just a little bit more about the Family Care Center? What happens there?
Of course, the Family Care Center is an emergency shelter for families with children, and we do accept all of our referrals into the Family Care Center through the coordinator entry system for families, as Nikki had mentioned earlier. The shelter is actually pretty cleverly designed in partnership with Homemade Orange County, and it allows us space for 18 families. It's kind of a modular system, so we're able to adjust the space according to the needs of different families of different sizes. And while families are there, we provide them with three nutritious meals a day, and we connect each family with housing navigation services. Our ideal is to create a plan, an individual plan for each family to be able to assess and address their needs and connect them to housing as soon as possible.
Wonderful, thank you. Timothy, can you share what are some of the common reasons as to why families fall into homelessness in Orange County?
Of course. Falling into homelessness, I think, is something that people we often think that it's something that happens to other people. But we find that for families, just as anyone else, there are many families that live here in Orange County among us that are just one unfortunate event away from falling into homelessness. Right? It's hard to make ends meet, and if someone gets hurt or someone gets sick or if someone loses a job, especially, and we can see, we can anticipate a real need coming as the months go on through the current COVID pandemic, that folks have struggled a lot with unemployment. Folks have struggled a lot with juggling schedules with kids being at home from school and daycare, and we're seeing increases in really challenging circumstances as people are coping with the realities that we're presented with, and so all those reasons are potentially things that could lead to homelessness. Right? And so what causes family homelessness is both systematic and that it's hard to afford rent and it's hard to maintain income, but it's also individual, that things happen to all of us, right? And the way that we cope, the way that we plan, and what we're equipped with to cope with those things, they can run us out of resources, and without a network, without support to stay housed, it's really easy to fall into homelessness.
Thank you for those insights, Timothy. Nikki, I'd love to hear from your vantage point. How have you seen COVID-19 impacting either the number of families becoming homeless or the reasons why they're falling into homelessness?
Sure. So certainly the loss of employment or underemployment, or families even feeling pressure to move before they receive an eviction is something that we're seeing. And then oftentimes a lot of the families that we work with are doubled and tripled up into one home. And so if there's 3 families living in one home and someone needs additional family members to move in, another family might end up having to move out. And then that's a reason that they can become homeless as well. Many households are experiencing challenges in finding employment right now as well, which means getting into their own place is even more of a challenge if they currently are homeless without that ability to be able to show that they have an income coming in. And Timothy mentioned that same thing too. So childcare is a barrier. You know, all of the expenses that families are having to pay for right now. And then if you're having to work from home and taking care of a child, or if you're homeless, but you're still working, but you don't have anywhere for your child to go, that's another issue. An increase in length of time of homelessness we're seeing because folks are unable to regain employment or find childcare. So we're seeing the length of time of homelessness expand a little there too. We also see that longer lengths of utility and rental assistance are needed for families when they're entering into our programs because they've experienced that loss of income or they found it difficult to regain employment again. So, you know, pre-COVID, we would average maybe 2 to 4 months of rental assistance requests for prevention programs. And now we're seeing those requests people are asking for 6 months, and we anticipate it to be even longer. So that's a huge issue for the families that we're working with as well.
Yeah, that makes sense because of the impact of COVID. So thank you for sharing for those statistics with us. Nikki, I'd love to hear, I think sometimes when people think about homelessness or the face of homelessness, sometimes families are forgotten when we're thinking about kind of what that looks like and what that experience is for people. Would love to hear from you. Can you just share with us a bit more about the specific vulnerabilities that families face, and in particular, the children face when it comes to experiencing homelessness?
Yeah, of course. So certainly when a child is homeless with their family, it creates a completely different set of barriers and challenges than, say, a single or a couple that would be homeless. The first and foremost would just be safety, right? So children are more vulnerable, of course, when they're experiencing homelessness. If they're not in shelter, they have less access to good education and access to healthcare and nutritious foods. You know, homeless families are living already in these extremely transitional situations, which of course can lead to trauma for children and for issues that the family as a whole is going to encounter in their lifetime. So the reality is that, you know, a family stays wherever they can, right? So one night it could be in a shelter, the next night it could be on a friend's floor, the next night could be a motel, and yet, you know, the next night could be, you know, another floor someplace. So you could imagine when there's children involved with this, how difficult and challenging that would be to make sure that there's any sort of regular routine, which would just seem impossible, let alone making sure that they're able to access school. And of course, in the worst of circumstances, homelessness for families and for anyone is dangerous. It puts children and youth at risk of physical harm, including physical and sexual abuse and trafficking. Of course, not by their own family, but we're talking about those who prey on the vulnerable. In all circumstances, homelessness results in trauma for children and youth. It creates instability and disruption of a child's education and emotional well-being and mental health. And it means situations of constant uncertainty for families that are experiencing homelessness. You know, just because a family is working doesn't mean that they can't also be experiencing homelessness simultaneously. We have parents who are working and homeless. When that happens, childcare or a safe place for a child to be while the parent works becomes a huge barrier. So if the parent can't afford childcare but has a job and is homeless, oftentimes they have to quit their job because they know that they just can't leave their child alone. regular access to nutritious food. So, oftentimes kids are getting the cheap, fast processed food, which is readily available in a lot of areas, and that can lead to health and developmental issues for children as well. And then, of course, access to education. So when a child is homeless, they're less likely to access regular schooling. We know that consistency is the key to learning, which oftentimes these children just don't have that experience. Many don't have access to Wi-Fi or their own computer, which now, of course, everything is distance learning, at least partially with COVID. And so that just inhibits their learning process even further. And I'm sure many of you saw recently the two girls that were sitting outside on their notepads of a Taco Bell to access the Taco Bell Wi-Fi so that they could do their schooling. So there still is a significant digital divide also in our communities as well.
Thanks so much, Nikki. One of the things that you mentioned is around like online school. And so, Timothy, I'd love to hear from you. How did the Family Care Center adjust? How did your kind of operations practices, how did they adjust in light of COVID?
Of course. So one of the first adjustments we made at the Family Care Center in light of COVID was to adjust the hours of operation. So previous to COVID, the Family Care Center was only didn't run a 24-hour operation. So they operated in the evenings and in the mornings, providing a space for dinner and a space to sleep. But just for budgetary reasons and for operational reasons, we asked that the families not to spend the entire days at the shelter site itself. In response to COVID, in order to give those families really a space to be able to self-isolate, to be able to be not out in public, and not to be able to create social distancing, we changed our hours of operations to make it a 24-hour program. As the school year began, we needed to keep up that schedule in order to give the students, the children staying there, a space for them to continue their educations. Nikki mentioned earlier the trauma of homelessness and the trauma it takes on kids, and part of that is a sort of a not continuous education. Right? So we want as much as possible for the education of the children in these families to have as little interruption as we can provide. And so it's really important for us to provide a space for them to participate in distance learning. Thankfully, all of the students that were staying in the Family Care Center were connected to laptops through their schools. The school districts provided Chromebooks for those students. But we were able to provide them with space to access their online learning, and with a reliable Wi-Fi connection, so that they didn't have to be outside of Taco Bell, and so they could be inside, in the cool, in the air conditioning, because we know that the temperatures have been up in the hundreds recently, and so we were able to give them a space, outside of the elements, and a space as much as possible where they can continue their education.
That's great. It's wonderful to hear how you've been able to adapt to help make sure any of the children at the shelter are able to stay in school, have that stable Wi-Fi access. Thanks for filling us in on what you've been up to. Nikki, I'd love to learn from you, sort of what has been the community response when it comes to, say, families who are experiencing homelessness, or families who might be, multiple families living in the same apartment together. What resources might there be available if one of them did test positive for COVID-19?
Sure. But I did want to loop back to the last question that you asked me, because one of the items that I forgot in terms of vulnerabilities for families and children is the risk of their items being stolen or confiscated. And so, we think it's, oh, great, let's pass out computers. But then they're also very concerned if they're living on the streets or in a park somewhere that their items could potentially be stolen or confiscated. So I did just want to put that out there as well. So just real quickly, in terms of the way that we've had to change our operations, we've moved to 100% virtual and online. with the families that we are working with. And that's actually been great. We've been able to do that. So the family system has a program very similar to Project Room Key that's an offshoot of that, that's in response to COVID. So we're able to provide motel vouchers to the children and families who are in need, not children separately, but with their families. So and of course, our goal is to provide that temporary place for a family member or an entire family if needed to go to a motel and be in a safe, comfortable place while they are recovering from COVID. And so these families could, potentially already be homeless or be at risk for homelessness, or again, might be that doubled, tripled up scenario that you mentioned, Bex. And so to make sure that families can have a safe place to quarantine or isolate during that period of time is crucial. And then we also ensure that there's some sort of light case management provided to those families so that we can make sure that they have rides for their medical appointments if they need to get a checkup for COVID, and that they have food and sundries available to them, diapers if needed, mask and a thermometer, so that they can also, check themselves and check the temperature of their kiddos. And if they are at risk for losing housing during COVID, so there's kind of two pieces, right? There's this people that might be unstably housed and or at risk and need a safe place to quarantine and isolate during that time so that they don't expose COVID to others. So if they really are at risk for losing their place, then we connect them with our access points for prevention and diversion services. And if they're literally homeless, then we have the family bed shelter reservation system, and we're able to see any housing opportunities that are open in the community to get those families connected to those shelters. So, and again, just like Mercy House, I'm sure we've had plenty of our families end up at Mercy House to help during the transitional period. So we've really tried to create that safety net for families so that it's not just another, it's not something else that's happening. So when Tim mentioned the heat, it wasn't just the heat, but it was also the smoke, right? So we have families that have significant health issues. And so for them to be living in a park with a child who has asthma during COVID and the high temperatures and the smoke, I mean, it's crucial that we're able to provide these services and to continue to provide those services, not just during the pandemic, but all the time. That's really crucial for us.
Great. So you mentioned a number of sort of potential resources that are available for families. And a question that we get asked quite frequently is, what should somebody do if they know a family that is concerned that they might be about to fall into homelessness? And then we also get asked a lot, like, what should somebody do if they see a family that appears to be experiencing homelessness? How would you direct people to respond?
Yeah, great question. I mean, I think that the easiest thing to do, I could throw out a bunch of websites and phone numbers to you, but really is, first I would say don't wait. And if you know of a family or you're concerned that they might be becoming homeless during this time, you can simply call 211. And that's a direct number right here in Orange County that will link them directly to us. That you can also visit their website, and I think some of those are going to be, that website address will be put in the chat box as well. So if a family has the ability to access the internet, they can easily enter their information into the system online. If they need to call in, they'll be able to talk to a representative who can also take that information down as well. We then contact the family to explore the different options and opportunities that work best for them, and to help prevent or divert them from, or house them if needed, during this time. And really, you know, folks should not feel embarrassed to ask for help. We understand most families live paycheck to paycheck, and heck, I would say probably most of us live that way. And it's so much easier to, as Tim mentioned earlier, to prevent family homelessness. And it's so much less disruptive for the family system. So, you know, if you know of a family, or if you are a family and that's a concern, please just contact 211, and hopefully we can get connected soon. And then also, if you see a family who appears to be homeless, I would offer them the same suggestion, right? You can invite them to call 211, and it would be the same process there. And then that way they can help determine what services are needed and really what that family is looking for. And that would be the route that I would take, is to just contact 211. And there's just so many wonderful providers in our community working to end family homelessness, and we're really grateful to so many of them, and that they're part of our collaborative and that they're part of the solution. You know, at the end of the day, we want to help provide those services to the families that's most helpful and beneficial to them and to the community. So I hope that answered your question.
It did. Thank you so much. Timothy, I'm going to come to you for our last question today. So we often get a lot of people who want to get kind of involved. And I wanted to ask you, does the Family Care Center have any current needs that our viewers might be able to assist with? And if so, how do they get connected?
Well, absolutely. If it was 6 months ago, we had a huge need for all things related to PPE and masks and gowns and those types of things. We had a scramble to find touchless thermometers for a minute there, because there were none in the world, but we've now come across a couple of those. But PPE continues to be a need to protect our families and protect our staff members also. Especially, we're finding now it's difficult to get a hold of nitrile gloves. So I know that if there's anyone out there who wants to make a donation of items, nitrile gloves is something that we're presently trying to look for to get across our shelter programs.
Wonderful. And then should they just go on the Mercy House website to get in touch?
If you go check out mercyhouse.net, you can find, there should be a link there for donations. If not, I can post. I can have someone post in chat about connecting to our development team.
Fantastic. Thank you so much. And this does bring us to the end of our time together today. So thank you so much, Nikki and Timothy, for joining us. Thank you to everybody who tuned in, and thank you to everybody who sent in questions in advance to help shape what was a really great conversation today. We'll be back in October with some more virtual events. Until then, please feel free to follow along on social media and stay up to date with what's happening with United to End Homelessness. Thanks, everyone.
Thanks, Bex.
Thank you.